There's a lot of different types of private equity groups that look at investing or buying out healthcare companies. And some of those are strictly physician practice type healthcare services. Some of them are healthcare ancillary services, where they're a company that provides services to a doctor's office or a hospital or some other kind of practice. But depending on a number of factors, you've got groups that'll only get involved with, say, a physician's practice. And every state's a little bit different with the laws that are in place as to who can own or be an investor in a medical practice. So you'll have different ways of going about it, where the private equity groups have to structure things a little bit differently, and maybe they just buy the assets instead of the whole business or something to that effect. But wherever they do want to get involved, they'll find a way to structure it to make it within the bounds of whatever requirements are in existence in that state, and then go from there. And the more you get away from human healthcare delivery, where it's doctor patient, the less those requirements exist. For a veterinary practice, those requirements really aren't in play as much, because people aren't typically so concerned about who owns the veterinary practice compared to who owns their pediatrician practice. And that can kind of open up some extra avenues. Sometimes it makes it a little bit more competitive for the investors, because you get more groups that want to maybe go into a business that isn't so highly regulated, but they still like the healthcare piece of it. And they'll go towards a veterinary practice instead of towards a family general practice or a pediatrician's practice or things of that nature. The whole industry, the whole healthcare world gets convoluted fast. There's hundreds of them that really get into that. And some of them are very specialized in, we'll do healthcare, but we're only going to do physician practices. And some will say, we'll do healthcare, but we'll only do the ancillary services. So we just care about a business that provides maybe software to a physician's practice, or they're a big equipment vendor, something like that. And even within that, you'll have groups that get very focused and say, we do healthcare, but we really only care about ophthalmology, optometry, and that's it. Or we do healthcare and we'll do home care, and maybe we'll get involved in a few other kind of very basic family practice physician groups, but not really anything besides that. And then some groups that are really just only concerned with the fact that it's healthcare, and as long as there's a physician involved, that's what makes them happy. They want to partner with physicians. Many of the times you see that, it's because one of the founders of the group or a major investor of the group is a medical doctor and has that background and knows how to work with other doctors, may have a little bit more of a business acumen, and can be a resource and a guide to the doctors that they partner with as they go forward and try to take a one office basic physician practice and turn it into the premier practice in the city or something to that effect. So the biggest problem that we solve when it's in the healthcare world and it's physician practice specific is really understanding revenue and what's going on. Because in healthcare, it takes a while to get paid. Just like you get bills at home if you've got to go see a doctor and they don't make sense, and you don't really know why you got 3 bills for one visit and all the different pieces that happen on the patient side. It's complicated on the physician side too. So it takes a while to get paid. Depending on any number of factors, it might be anywhere from 30 days to 6 months after you perform a service before you finally get paid. And if you're out of network, it could be 2 years before you get paid. So what we're doing is, especially early on in those projects, we're working and looking at the revenue and trying to make sure that just because they've collected $10 million this year or $20 million this year, that doesn't mean it all was from this year's work. That could be from last year's patients that came in, or some portion of it that's spread out over time because it took a while to collect, or they had one payer that was just very slow, or they had a dispute, and 7 months after the services happened, they finally got a big payment. So we really focus on that, because that can make the difference between a business looking very profitable because this year looks great, or really last year was great and this year was not so great. and they've lost a bunch of patients, and there's the volume of services is going down, but it's not going to be for another 6 to 12 months before you really see that in the bank account. So when you engage us and where we're doing that, we know that one of the big things that you want to know as the investor is business might look good on paper, this practice might look like it's growing, but if it's not growing, we want to know that. Because if we just go into this blind and all of a sudden find out that revenue is not as good as we thought it was because the practice is shrinking instead of growing, you're going to be in a really tough spot a year after the deal closes. The results is the cash in the bank account, but there are leading indicators of things not going as well as they should, and that's the number of patients that are coming in, the types of insurance payers, and whether that's changed over time. You might be getting a really good reimbursement from Blue Cross. United doesn't pay as well for the same service. And if that has changed significantly, that's going to change what the cash is going to look like in the future. And the same thing if you went from being almost everybody was Blue Cross and Blue Cross paid the full bill to now you've got a lot of people who have a pretty big patient responsibility, deductible, copay, something like that. And as those numbers grow, the chance of collecting it goes down. Where Blue Cross may have paid the full bill, Blue Cross is only paying a portion now because the patient's supposed to be paying some. Things could look good today, but down the road, when you have trouble collecting on that patient portion, it's not going to look as good and the cash isn't going to show up in the bank account. General practice, you're really just looking to see what the volume of the patients is, because the chances that other things have changed drastically is not very high. Insurance is probably going to pay pretty steady amounts for certain things, regardless of what insurance company. So as long as the volume has stayed in pretty good shape, then as we go through the rest of the work, we would expect that the cash is going to remain pretty healthy. Sometimes that doesn't happen for plenty of possible reasons, but usually that's the case. If you get into something that's a little bit more complex, maybe a substance use disorder business where they're running a inpatient rehabilitation clinic that's got any number of beds where they're really doing some very serious alcohol or drug rehabilitation treatments, but they may also have some less severe levels of treatment, outpatient work or more kind of consultation work. And in those types of businesses, you look to see what the volume looks like, but the difference between insurance companies can be pretty drastic. So if the volume stays the same, but the insurance company has changed, that might lead to a pretty significant change in cash in the future. Or if the types of service has changed, it went from maybe partial hospitalization, which is a very severe treatment plan for alcohol or drug use disorders, being very heavy, to now that's a lot less, but intensive outpatient care is heavier. Well, the payment reimbursements in those two are pretty different, and so is the cost of performing those treatments. So as those things change, there could be some pretty drastic changes in cash and profitability at the end of the day and looking into the future. Sometimes we'll be able to see that the rate that the insurance company is paying or could pay based on the contract is lower than what the company's billing because they haven't changed what they bill in years. They bill $200 for this x-ray because they've always billed $200 for an x-ray. Well, over time, Blue Cross may have said, we pay $215 for x-rays. But if you only bill them $200, they're only going to pay you $200. They're not paying you more than what you bill them. So sometimes we'll see that. It's rare, but it happens where we can say, we see they're billing X and they're collecting all of it, but actually their contract says the fee schedule allows for them to bill more. And they could collect more if they bill $215 instead of $200. That'll happen from time to time. One other thing we'll see is in certain instances, the VA, Veterans Affairs, they publish the fee schedule for all the services that they pay for. But sometimes, depending on the locality and needs and maybe providers or lack thereof in the area, they might pay more than what the fee schedule says. If the fee schedule says we pay $1,500 for this alcohol rehabilitation treatment per unit, but they're actually paying the company $2,000 per unit because they made a decision at the VA that we need to pay a little bit more for this right now. Well, that's great, But the company's at the whim of the VA deciding that, okay, now it's time to pay down to what we said we would, which is $1,500. So we may be able to see that from all this information, business looks great. They're getting paid a lot, but at the flip of a coin, the VA could say, now we're going back to what we said we would pay. And overnight, you get paid 25% less. So it just becomes a warning that this is here. The cash is real. This is actually getting paid. Who knows when that's going to end? That could change tomorrow. It may not change for 10 years. We can't tell. Best case scenario, we get called by a PE firm right before they're about to sign a letter of intent. So we've got a little heads up that there's something going on, and we're ready to go once the letter of intent gets signed. But ready to go is just, a factor of what they need. And maybe they need a full financial diligence project to really understand everything that's going on in the business or the healthcare practice or whatever they might be investing in. But maybe it's healthcare and it's kind of small. They know everything about that niche of the healthcare world. The only concern they have is whether or not revenue is truly there like it seems to be. So, our task could be customized to just worry about things they don't know and only focus on that, because as a cost saving measure, a time saving measure, that might be the most important thing. Just worry about revenue. They can worry about the expense side of it, the operation side of it. They're not really concerned about that. But if they can hand off to us the work to make sure that revenue is good, hopefully that saves them some time, some heartache, and gets them a lot more comfort that it's either good or not good to make this investment. When we talk to groups about doing, whether it's just a very customized, specific due diligence project or really a full due diligence project in the healthcare world, we're always getting questions from these groups of, what's your experience dealing with these types of payers in this industry? Do you understand how these guys are going to operate if everything's out of network? Or we think they're all in network. Can you help us figure out what their fee schedules are and what their contracts are supposed to be and how that works? And really, healthcare is one of those things you can't just moonlight and do one of those projects every 2 years. There's too many complications and too many regulations involved that really change how the business operates compared to a restaurant down the street where everybody pays in cash when they get their food. So it's very different. We expect those questions. We've done so many projects that we know how it works. Ophthalmology is going to be different than dentistry, especially if you've got orthodontics involved in dentistry and how long that treatment is versus, going to an optometrist to get your eyes checked or going to an ophthalmologist to get LASIK. It's, done in 25 minutes. You don't have braces in 25 minutes. You got it for 2 years. And that changes how the business operates. And an outpatient imaging center is going to be different than veterinary clinics. And as you get more specialized in different areas, the nature of the practice changes, the nature of the way they get paid changes, the employees change, and all of those things have an impact on ultimately how profitable the business is going to be.